My name is Kate Kelley, and I am Strategic Advocacy and Policy Counsel for Planned Parenthood Association of Utah. We served in last calendar year, we had 46,809 patients in the state of Utah, and we had a total of 121,000 visits in our different healthcare clinics, and so we see a lot of people. Planned Parenthood provides health services for a sliding scale fee for people in Utah. We have 11 health clinics and rural healthcare providers as well. And at the clinics, we provide a range of services regarding reproductive health. So we do cancer screenings, we do pap smears, we do STI testing, we do well woman exams, we provide treatment for STIs, and we also provide abortion care. Governor Herbert has attempted to defund Planned Parenthood, but the state of Utah actually doesn't give any money to Planned Parenthood. So it's like, oh, we're going to take money away from them. Oh wait, we don't actually give them any money. And so what they've tried to do is stop pass-through grants, which are money that the federal government gives to the state of Utah and then spreads it out. So we have 3 of those grants through the health department in Utah, and so he said stop giving that money to Planned Parenthood. It's actually a very small percentage of our budget, and we're currently suing the governor over that, so we still have the funds. They've not been taken away until the end of the grant cycle. So we actually, because we're involved in litigation and we're suing the governor, we still have the money. It didn't actually get taken away.
What services do those funds go to?
So they were 3 very specific grants. One was for a public health program to track the ways in which we do testing. Another one was to do STI screenings, and another one is an after-school education program for kids. A lot of folks who come to Planned Parenthood have a financial need, and we provide services based on a sliding scale fee, so based on your ability to pay. There's a lot of focus when Planned Parenthood is discussed on abortion. We do provide abortion care in Utah, but we actually didn't used to. The reason that we started providing abortions is because of a 2010 law that was passed. Abortion care providers stopped providing care in Utah, so there used to be, I think, 12 different places you could go in Utah, and that went down all the way to 1. And so we stepped in and started providing abortion care because of that law. But it's a small percentage of what we do. In Utah, it's less than 1% of the services we provide are abortions. Abortion is a very necessary and worthwhile service that we provide. It's a pretty small percentage. And so I think a lot of people who are anti-Planned Parenthood or work against Planned Parenthood really focus on abortion care, and really their aim is to stop women from being able to have autonomy over their bodies. So federal funds are not permitted to be used for abortions under any circumstances. So we actually have a separate clinic where they're performed that has separate funds, separate bank accounts, and none of the funding is permitted. No federal funding, not just in Utah but anywhere, is permitted to go to abortions, except for in certain circumstances Medicare can be used, Medicaid can be used. And so those are traditional exceptions like life of the mother, survival of the fetus, rape, incest. And so in those cases, women can access the federal insurance program to cover Medicaid, but almost in no other circumstance can the fund be used.